And this is a procedure. You sit in for an examination that is structured in three folds. One is has to do with the MCQs. You answer an MCQ and a written part, and the third part is a viva. Viva is like an interview where you are interviewed to speak on defend what you've studied, your knowledge. You defend it. And so with this one, you do they schedule a time for you to sit for this examination. You need to prepare on specific topics that is related to the geographical area. And when you pass the MDC, then you would be posted to do house job or housemanship first year and second year. After second year, you receive your permanent primary license exam. So you become, in Ghana, you become a medical officer. It's more or less like a general physician. And after the medical officer, you can think about doing a postgraduate or something in them. Now, when you go to Australia, the Australian also have the Australian Medical Council examination. Now, they have two pathways. The first pathway is that you will have to write an MCQ, which is an internet-based examination. So if you're able to pass their MCQs, which is much more competitive, then you would also be enrolled into doing some clinical skills. When you are able to pass through, then you will start. They also would put you on a foundation year, another program in the hospital for a doctor to shadow you, to teach you and integrate you into the Australian system. That will take about 2 years before you can become a general practitioner, or you can decide to go on another residency. So I think these are basically the countries a lot of students really want to go. But aside that, any other country also have their own way of entering and practicing medicine. Yeah.
Thank you so much, Isaac. We have another student with us. Can you tell us your name and where are you from?
Yeah, I've said there is Rutaisile Nicholas from Rwanda.
All right. So, Nicholas, which year are you in?
I'm in the last year, 6th year. Yeah.
So you'll be writing your exam after this year, right?
After graduation, I go back and do an internship, and then do exam.
Okay. So my question is, after studying for a period of 6 years in China, how does China train you competitively to write your exam in your country? Can you tell us a little about that?
Exactly. Medicine, actually, general medicine is the same. So I learned international books, and I was with professors and teachers. They trained me in all angles. But what we know already is about a system in the country. Which system are you following? So in different countries, like my country, of course, which is different from Asia, there is a system that it has to be followed over there. So what I have to do, I cannot go there and do exam immediately. I got to enter into a system. Then after knowing the way they treat tropical diseases and the other skills in 1 year, that's why they give that 1 year of internship. Then I will do exam. Yeah, but if you graduated from my country, you don't do it. You know the thing, so you continue to be the doctor. And if you graduated from East Africa, because my country is in East Africa, so if you graduated from there, then because it's the same area, then you after graduation, then you do exam straight without doing internship. Yeah.
Okay, thank you so much.
Last thing to say.
Yes, sure.
Yeah, so I forgot to say that if English language is not your mother tongue and you want to practice medicine in the UK, you have to prove that you can speak English. And so there are some examinations that you have to take. Basically, they like the International English Texting System, language texting system, that's the IELTS. And then also you can also try and get the SAT, the Scholastic Aptitude Test examination. So, but mostly they like the IELTS for the UK, and it's acceptable also in Australia as well. Then the IELTS has two parts: the academic and for the general and academics. So normally either of them it's acceptable, but mostly the academic, because medicine is more or less academic. And so if you are planning on going to an English speaking country, then you need to have that in your mind. Now if you're planning to go to Germany, they speak German language, you also have to pass at least their language B2. They classify it as B2. So you need to pass their language B2 because it's the local language that is being spoken by many people. And to be a physician, you need communication, and